what is happening when you have insulin resistance that has progressed to prediabetes? Your body is unable to adequately process the sugar that you're eating and move it rapidly enough to where it needs to go so the level of sugar in your bloodstream stays higher for longer than it should. And there's a lot of problems that can happen when you have higher than normal blood sugars, even if they're not in the diabetic range. So one is your body has to produce a higher amount of insulin to be able to get the blood sugar out of the bloodstream because of that resistance. And insulin circulating all the time has some pro-inflammatory or causes inflammation properties. And that's what underlies a lot of the chronic health conditions that people think of: cardiovascular disease, heart attack, stroke. And those are sorts of things that is insulin resistance and prediabetes and type 2 diabetes then contribute to. And so it's a risk that's really serious and has some really serious conditions associated with it. But when you are still in the insulin resistance prediabetes stage, haven't already crossed over the threshold into type 2 diabetes, it is much easier to manage this than it is once your body has kind of gotten burned out with trying to keep the blood sugar low enough with overproducing insulin. And that's when the blood sugars continue to escalate and cause that type 2 diabetes. And so it is a lot easier to manage at this stage. So it's a good stage for us to catch things because we can make smaller, more sustainable lifestyle changes and ideally avoid medication if possible by just making some adjustments to things of our lifestyle.